Treaty on Matters Disability Inclusion has become a source of concern among medical experts home and abroad. According to the experts, this goes contrary to the pledge that ought to ensure persons living with disability enjoy the highest attainable standards of healthcare without discrimination on the basis of disability. The health inequality stem from poverty, exploitation, violence, and abuse. Meanwhile, young Kenyans have been advised to exercise their young age to avoid diseases that might crop up as someone is growing old. The society has also been urged to promote and support exercise that will improve the health of an individual. Health professionals from Australia today morning conducted a lecture at university students at Mount Kenya University, advising them on why it is important to be active and ensure health issues are given priority.
But what that actually means is that Kenya has an unequivocal obligation to make sure that people with disability are included in all parts of life. In terms of whether we have arrived there, it is very, very difficult to live up to our obligations under the UNCRPD. Australia finds it challenging. Kenya is finding it challenging. But in answer to your question, I think there has been so much change since the signing for Kenyans with disability. But I also think that there's obviously a lot more work to be done.
I mean, it's really trying to look back and reflect on what's happened, what went wrong, and what can we do a little bit better. The issue, most likely the next pandemic is going to be a respiratory pandemic again, and the issue of good indoor air quality is essential to prevent that. So I think that's something we need to focus on. But there needs to be investment from key bodies and the government to make sure that the lesson we have learned are now implemented and not just put in a drawer.
Diseases, so cardiovascular disease, metabolic disease. And I said before, it's not just the young people that we need to focus on, it's teenagers. Often when they start studies at university, they stop being active. Life's too busy. But no, life's not too busy to be active. We sit down too much. Every couple of minutes, get up and move around. It's good for our body. Even through the older people. Older people complain, oh, I'm too sore, my muscles are sore, my joints are sore. It's because they've stopped being active during their 20s, 30s, 40s, 50s. So I think it's important for society